Approximately 23.6 million people from United States are suffering from diabetes mellitus. Due to diabetes mellitus, the number of patients with a chronic non-healing diabetic ulcer is increasing. According to the study, 81% cases of diabetic ulcer result in amputation due to inappropriate wound healing, costing an average $20,000 to $60,000 per amputation. Since 1985, the use of platelet-rich plasma, which is also known as a PRP treatment to treat the chronic non-healing diabetic ulcer, has been increasing. Early use of PRP dressing has a potential to prevent amputation by healing chronic diabetic ulcer, which also decrease hospitalization and reduce treatment costs. PRP can be prepared in a multiple hair care setting within a short period of time. Platelet-rich plasma had a lot of advantages. For example, it releases locally acting growth factor which initiates wound repair. It suppresses cytokinase release. It limits inflammation, interacting with the macrophages to improve tissue healing and regeneration, promote new capillary growth, and accelerated epithelialization in chronic ulcers. In 2010, meta-analysis of research study on effectiveness of PRP treatment shows that the healing rate of non-healing diabetic ulcer treated with PRP dressing was significantly higher than in control group. However, due to lack of knowledge, majority of nurses rely on wound care nurse to initiate PRP and to reapply on diabetic ulcers. On the other hand, most of the patients are unaware about PRP dressing and its benefit. So, patients do not prefer to apply PRP dressing on non-healing diabetic wounds. Therefore, in order to successfully treat non-healing ulcers with a PRP dressing, it is very important to provide education, training, proper environment, and motivation to the healthcare employee, and adequate knowledge and information to the patients. Prolonged hospitalization and the possible amputation due to chronic non-healing diabetic ulcer not only raise the costs of treatment, it can also change patient lifestyle. Therefore, PRP can be a treatment of choice to heal non-healing diabetic ulcers. In 2006, randomized control research study by Vicky shows that chronic diabetic ulcer treated with a PRP dressing healed 68% of wound within 45 days of treatment. However, wet to dry dressing healed 42.9% of wounds in 85 days of treatment. The cost of treatment for chronic diabetic ulcer treated with PRP gel was $15,159, whereas a treatment cost of saline gel was $33,214 in total. Therefore, there is a scientific evidence that the plasma-rich protein dressing is the best practice to heal the chronic diabetic wounds. Study shows that PRP treatment healed non-healing diabetic ulcer within a short period of time and with a minimum treatment cost. Therefore, it is important to educate medical personnel and patients regarding PRP treatment and its effectiveness, to establish PRP as the first-line treatment method, to increase utilization of PRP treatment, to minimize the risk of amputation, and most importantly, to heal chronic diabetic ulcer on time effectively. Thank you.